Hi, Dr. Emily Shaheen here. Talking a little bit about trigger finger. So options that we have for treatment are steroid injections and surgery. Of course, we can always try things like bracing and anti-inflammatory medication and those sorts of things, but typically patients have tried that by the time they come see me. And so once I see them and they fail those things, we start talking about more invasive options. So steroid injection is something that we do in the office. So if you came to see me in the office and we evaluate you and kind of decide that's the direction we want to go, that's a procedure we can do that same day. So the surgical option would be basically a procedure that I typically do in the office under local anesthesia for folks. We can do it in the hospital if people are worried about being awake for the procedure. But basically we inject some numbing medicine into the skin where we're going to be working, make a small incision over the little structure that's compressing the tendon and causing the symptoms, and then just release that little tunnel. It's about 1 centimeter long and it's putting pressure on the tendons. You get a couple little stitches and we zip you up, and then you get a soft dressing. You can move your fingers right away. Some people drive themselves home, because we're not giving you any sedative anesthetic medication and you're not on any pain medicine. Some people choose to have a family member drive them home after the procedure. But that recovery takes more like 2 weeks to 4 weeks, but it typically is a definitive treatment. So that's the difference between the steroid injection, which can potentially come back because, again, we're not structurally changing what's going on, we're just decreasing the inflammation, versus the surgery where we definitively fix the problem. So if you think you may have trigger finger, come in and see me and we can kind of look at what you've done so far, how severe your symptoms are, and talk about what your goals are and decide what treatment option is best for you.